Mission and margin is the business of healthcare.
Welcome to Business of Healthcare. I'm your host, Matthew Hannes. In this episode, we explore virtual triage, which is the use of AI-driven chatbots to triage patients to the right venue of care at the right urgency. Virtual triage is deployed as patient-facing on websites, patient portals, and in digital apps. The same tools can be used by non-clinical contact center agents while speaking with patients by telephone. This application is called evidence-based scheduling. To explore virtual triage, we speak with healthcare leaders who are working with Triage Bot, a virtual triage solution used by healthcare systems around the United States. Triage Bot uses algorithms from Isabel Healthcare and Medchat and is built on Medchat's HIPAA-compliant chat platform. We start with a Triage Bot demonstration provided by Medchat and Isabel.
Triage Bot helps patients find the right care at the right cost in about 90 seconds. Hundreds of healthcare organizations use Medchat's HIPAA-compliant live chat and chatbots platform, equipped with AI and machine learning. Isabel Healthcare has provided differential diagnosis algorithms globally for over 20 years. Together, Medchat and Isabel have created Triage Bot. Health systems, payers, and physicians deploy Triage Bot on public-facing websites, secure portals, and in digital apps. Triage Bot provides HIPAA compliance with no need for patients to download an app or manage usernames or passwords. The tool is deployed with the healthcare organization's brand color, logo, and preferred wording. Non-clinical call center agents use Triage Bot when speaking with a patient or member by phone. Consider Charlotte, a busy mother of 3 who's worried if she has a sinus infection. She's trying to decide if she should go to urgent care this evening or squeeze in a visit to her doctor in the next few days. Charlotte prefers using chat instead of phone calls to get things done. While looking online for her doctor's phone number, she discovers Triage Bot. The modern and concise user experience starts by collecting age and gender. If the patient is female, Triage Bot asks if they are pregnant and adjusts the triage results accordingly. Next, Triage Bot collects symptoms, which the patient just types in. Predictive text is provided for 20,000 common symptoms, and a natural language processing algorithm converts any others to the appropriate medical synonym. Finally, we ask about onset, such as how quickly the symptoms developed, the patient's pain or discomfort level, impact on activities of daily living, medications, and chronic conditions. Triage Bot then recommends the best care for the patient's situation, such as urgent care in this case. Once the patient selects the care they need, Triage Bot helps get care started. This can be as simple as linking to online scheduling or check-in, or even click to call. Triage Bot can also integrate with electronic health records for seamless scheduling. Patient identity is verified with 2-factor authentication, and triage results are stored in the patient's record. And with that, triage is complete. Patients can access an agent through live chat or phone throughout the process. Triage Bot has been clinically validated in 20 published independent peer-reviewed studies on accuracy and efficacy. The algorithms are used in medical schools and residency programs to train the next generation of clinicians. 92% of patients report they would use Triage Bot again when seeking care. 36% of patients convert to the recommended care, creating access for new and existing patients. By providing Triage Bot, you help your patients find the right care they need in real time, every time.
To learn why healthcare organizations are deploying virtual triage, I reached out to Ken Riley from Bay State Health. Ken, tell us a little bit about your work in virtual triage.
Hi, my name is Ken Riley. I'm the Director of Patient and Population Health Technologies for Bay State Health. My role is to ultimately advance a lot of the tech that healthcare is bringing to the industry for our patients. I plan on spending the next couple of decades into retirement working outside bricks of mortar, working with patient technologies, making the experience of our patients seamless, exciting, and delightful. We had an experience with our patients about 3 years ago where they were using Dr. Google in order to look up a lot of their symptoms. And ultimately what ended up happening was a patient had a very poor experience with Dr. Google and decided to write an email to our CEO ultimately the CEO said, we need a way to be able to direct our patients to a curated platform for them to find their particular information. So that was the birth, if you will, of our virtual triage initiative. When one implements chat features on some of these services that we have, it gives more of a human feel to the communication that occurs between the patient and the provider. So instead of just a patient filling out a form and there's no real interaction, so to speak, they hit submit, it goes. A chatbot comes back and asks you a follow-on question. So the engagement factor, it has a more human feel to it. There's a give and take with that chatbot, and regardless of the fact that there may be AI in the background, it does provide the opportunity to plug a human into that chat as well in case we need to have subsequent conversations between the patient and the provider. So having that chat feature that can help with the communication back and forth, and B, provide an actual live person in the end is hugely beneficial. So a year from now, one of the measurable results that we are absolutely looking for is a decrease in our call volumes and an increase on the amount of digital touch points that are occurring through chat functionality. We struggle often when we try to do outreach to our patients. And frankly, we're running up against a lot of marketing out there where random calls are being made to people's phones, and people don't pick up phones anymore, especially if they don't recognize the number. And chat, whether or not it's web chat or SMS chat, really enables the ability for someone to kind of understand who they're talking to first, so to speak, without necessarily having to open up their audio line and be on the phone with somebody. So we're really looking to see a transference from one channel to another channel, and perhaps an increase of occurrences that are occurring through the web channels, simply because it's easier for people to interact and find information during their lives without having to take time out, walk outside of a room, and get on an audio channel.
I asked Don Bauman from Isabel Healthcare why combining their machine learning algorithms with Medchat's HIPAA-compliant chat was so important to creating a great patient experience.
I think chat is a transformative tool for consumers to get access to healthcare. It's an efficient, easy way for busy folks to get their family members or themselves the right access to care. Although I think chat is really only part of the story. I think the other important part of the story is the underlying engine or algorithms that help consumers get to the right venue of care. The last thing we want to do is have somebody go through an experience, answer a whole bunch of questions, and not end up in the right place. So the engine can really determine whether or not that chat experience is a great one or a weak one. So Triage Bot uses an algorithm from Isabel created 20 years ago by Jason Maud, and I think Jason's the best one to tell that story.
Jason Maud, thank you so much for joining Business of Healthcare today. Tell me a little bit about the origin of Isabel and how it's used today around the world.
So Isabel started over 20 years ago when my daughter fell ill, quite very seriously ill with chickenpox, and the clinicians missed a secondary infection, which turned out to be necrotizing fasciitis. And she ended up spending 3 weeks on intensive care, 4 weeks on a high dependency unit, but just made it. That whole episode prompted me to think, what happened? Why was her diagnosis missed? And so from that, the idea grew of a system to help clinicians avoid missing diagnoses, and to have a system where they could enter signs and symptoms, press a button, and literally in seconds get a list of possible diagnoses, of things that could be causing the symptoms, make sure they haven't missed something. That system first became available in 2001, but today is now a really well tried and tested system that's been used by thousands of clinicians over many years, benefited from their feedback, from constant validation. And today it's now used by close to 300 institutions across the US, from primary care right up to academic medical centers. From the early days, I've always thought Isabel was a really clever brain that would be part of a much bigger whole. Healthcare is such a huge industry. And so what's really exciting now is to see Isabel combined with a chatbot, because what that does is it helps the patient, it helps them, takes them through that process, which can be quite troubling for them. The time they're using our tool is when they're worried, they're concerned about their symptoms. And so what the chatbot does is make that process smoother, more comfortable for them, and then hopefully direct them to where the most appropriate venue of care is.
Consumers use virtual triage online for self-triage. But what about the millions of times a year that patients call their provider's office for triage guidance? Those calls are often answered by non-clinical contact center agents. To learn how virtual triage can be applied in that setting, I spoke with Heather Francis from Banner Health. Heather is helping lead deployment of evidence-based scheduling, a form of virtual triage used by contact center agents when speaking with patients by phone.
So I am the Clinical Integration Director for Banner Health in our customer experience channels. And one of the things that our organization does is appointment scheduling for our ambulatory clinics for 2 of our medical groups. We've been looking for a tool that could aid our non-clinical scheduling agents in appropriate clinical escalation for our scheduling. So we have patients call in and they need to be seen for certain symptoms, and we want to make sure we're getting them in to see their provider in an appropriate amount of time, or if the situation warrants, we can get them to other venues of care within our health system, like the emergency room or urgent care. And we wanted to make sure we're reusing a tool that was consistent across both medical groups, that was evidence-based, and so we could have confidence we were doing the right thing for our patients. What happened for us is we were able to incorporate our processes into the chatbot, which we weren't expecting to do. It wasn't part of why we were looking for the tool to begin with. And to be able to guide the agent seamlessly from the beginning of that call through what they needed to do at the end to get them to the right level of care has been a huge win for us. It was definitely an opportunity that we had that we weren't expecting to be able to address with this tool. And now we're able to do both of those things at the same time. We're just like, oh my God, like it just makes us think of like, oh, we could do this next. Oh, you know, the opportunities. And I think what makes it so exciting is because we weren't expecting it. We thought we would have to solve that some other way. And it just, we're giddy about it. Really, I think the 2 things that we're looking for are safety for our patients. You know, first and foremost, making sure that we are able to see those patients in the amount of time that they need to be seen based on their symptoms, which is huge. And then the other thing is first call resolution. You know, being able to handle the concerns of our patients quickly and getting them seen in the appropriate level of care. So without a lot of communication back and forth with the practice, instant messages or messages through our EHR, we want to be able to help the patient while they're on the phone. I think that as a clinician myself, so I am a nurse, and knowing how important it is to have a evidence-based process by which you're handling patients, and having that physician engagement is crucial. But it's important to the clinicians that they have input on how our tools work. And if something were to change a clinical practice, or they want to review the way we have the business rules set up, or the scoring or recommendation sets, to have a process that they can voice that concern and it can be reviewed by a governance group of clinicians, and see if we do need to make some adjustments, just helps with trust and adoption of the tool.
Virtual triage elevates patient access to care, raises quality and safety, increases labor productivity, and elevates the overall patient experience. For these reasons, virtual triage has a strong mission and margin story. With that, we wrap up our episode today. I hope you found it valuable.
Watch, listen, or read Business of Healthcare interviews at BOHseries.com.